Animals with torsion of the spleen usually show acute symptoms of abdominal discomfort. Vomiting and lethargy are common. Abdominal splinting or sensitivity may be shown. On ultrasound, the spleen is usually greatly enlarged. Splenic veins are also enlarged, but may or may not show blood flow with color flow Doppler. This video is from a 7-year-old standard poodle showing lethargy and vomiting of food for several days. The spleen is usually ventral, lateral, or caudal to the stomach. Note that the spleen in this case is between the liver and the stomach. Splenic veins are enlarged, and color flow Doppler does show venous flow from the spleen. Partial splenic torsion was suspected and the spleen was surgically removed. The spleen was enlarged and very firm, suggesting clotting of blood in the spleen. This 7-year-old giant schnauzer had a history of abdominal pain, vomiting of food, and weight loss over a 6-day period. In the video, the folded spleen is compromising venous drainage. Splenic veins are enlarged inside and outside of the spleen. Splenectomy relieved symptoms. Chronic torsion or infection of the spleen could result in clotting and loss of blood flow in the spleen. In such a case, splenic tissue would become necrotic. With bacterial infection, the spleen begins to form gas as necrotic tissue decomposes. The patient becomes anorexic and lethargic. On ultrasound, the spleen is usually hyperechoic and contains gas pockets. Surgical removal of the spleen is necessary and extremely dangerous. Manipulation of the spleen during surgery results in release of toxic substances from the necrotic splenic tissue into the general circulation. Septic shock and death of the patient often results. Antibiotics and steroids should be given prior to surgery. All splenic vessels should be ligated with as little manipulation of the spleen as possible prior to removal. Prognosis is still guarded to poor. On ultrasound, this large mass was connected to the spleen. Gas artifact within the mass suggests the presence of gas-producing bacteria. After splenectomy, histopathology reported necrotic splenic tissue and bacteria. An old splenic torsion with gas gangrene was suspected. Abdominal effusion usually develops from one of 3 sources: the liver, the spleen, or the intestines. Effusion from the spleen is usually hemorrhagic and results from rupture of the splenic capsule due to trauma, enlargement of a benign splenic hyperplasia, or neoplasia. A sample of the effusion should always be collected by abdominocentesis. If the spleen appears normal on ultrasound, the liver or the intestines are more likely to be the source of the abdominal effusion. If the spleen has some form of lesion involving the capsule and the effusion is hemorrhagic, a hematocrit greater than 28%, the spleen is probably the source of the effusion and removal of the spleen is indicated. This 13-year-old lab has hemangiosarcoma of the spleen.